Okay, good morning, and thank you everyone for joining us for the Positive Choices webinar series. And in today's webinar, we're going to be providing some information about what parents can do to prevent teenage substance use. So a really important topic, and we're really delighted to have our speakers here with us today, so I will introduce those in a moment. My name's Lexine Stupinski, and I'm going to be chairing the session for today. And what I would really encourage you to do is to, if you have any questions, please do submit them. So on your control panel, you'll see there's a questions box. So please do submit questions as you have them during the session, and we will have a Q&A at the end where the speakers will be very happy to address those questions for you. And so the aim, for those of you that are joining us for the first time, the aim of Positive Choices is really to assist school staff, parents and students across Australia to access up-to-date information and resources, drug prevention resources that can be implemented in schools and that are proven to improve student well-being. And so this webinar series is part of the Positive Choices initiative, and one of the ways that we maintain the connections between Positive Choices and also teachers, parents, school leaders and anyone who's working with young people. So we'd love, if you have any suggestions for topics that you'd like to hear about on Positive Choices, we'd love for you to email those through to us at info@positivechoices.org.au. And over the year, we've covered a number of different webinar topics. And so just to let you know that if you would like to, if you've missed any of those sessions, you can catch up by viewing the session video and accessing the handouts at positivechoices.org.au/webinars. So we've had topics including personality-targeted interventions for prevention, also looking at the topic of the so-called legal highs, so what parents and teachers can do to respond to that challenge, looking at ways to engage students with evidence-based drug education, and also looking at some of the effects of drug and alcohol on the adolescent brain as it matures. So all of these and other topics are available on our website if you'd like some more information about those other topics. And we'll have more topics coming up over the year, so you can subscribe at our website to be notified. That's the best way to stay informed about those topics. And if you haven't already visited the Positive Choices website, I would encourage you to do so and take a look at the range of resources that we have available there. And there's the web address info@positivechoices.org.au if you'd like to suggest some resources that you think are missing or you think you'd like to see on the website as well. So now I'm delighted now to introduce our two speakers for today who are going to talk to us on the topic of what can parents do to prevent teenage substance use. So we've got the 2-for-1 deal. So first of all, we've got Dr. Louise Thornton, who holds a Vice-Chancellor Postdoctorate Fellowship at the National Drug and Alcohol Research Centre and the Centre of Research Excellence in Mental Health and Substance Use. And she's worked in the area of mental health and substance use disorders for over 10 years and has a particular interest in developing new technologies, so online and mobile based applications for prevention. So you can also follow her on Twitter to keep up to date with what she's doing, and she'll tell you a little bit about her Twitter handles, I'm sure, in a moment. And then we also have Dana Lytle, who will be joining us in the second part of the session, and she's a research assistant working also at the Centre of Research Excellence in Mental Health and Substance Use, and she's primarily working on developing a program for substance use prevention, so a program specifically for parents. Okay, so without any more introduction, I'll pass over there to Dr. Louise Thornton, who will start our presentation. Thank you, Louise.
Great. Thanks, Lexine. So as Lexine mentioned, you can follow me on Twitter, and I've just got my Twitter handle up there. You can also follow the Centre for Research Excellence in Mental Health and Substance Use at CRE Comorbidity for all the latest regarding co-occurring mental health and substance use disorders. But perhaps the most relevant Twitter account that you might be interested in following is the Positive Choices account. which promotes the latest news regarding the Positive Choices website, as well as evidence-based information for students, teachers and parents regarding the prevention of drugs and alcohol use. So as Lexine mentioned, Dana and I are going to be talking about what parents can do to prevent teenage substance use. So to give you a bit of an overview of what we're going to be covering today, I'm going to start off by talking about drug and alcohol use among young people in Australia. Then I'm going to hand over to Dana, and she's going to give a bit of information about the specific role parents can play in preventing drug and alcohol use among teens, and then talk a bit about the online combined student and parent substance use prevention program that we're currently working to develop. So drug and alcohol use among young people is a big concern for many parents, but it's also actually a really important public health concern. So to give you a bit of context, among all Australians, and this is just both teens and adults aged 14 years and older, in 2013, about 4 in 5 or 80% of Australians reported that they'd consumed alcohol in the past year, and about 6.5% of those had drunk on a daily basis. More than a third report that they have consumed alcohol at a level placing them at risk of injury, and 26% say that they've done so as often as monthly. We also find that the proportion of people in Australia having used any illicit drugs in the last 12 months has remained relatively stable over the past few decades at around 14%. But we find that about 42% of Australians report ever having used an illicit drug. So that's about 8 million people who've used an illicit drug in their lifetime. But what about young people specifically? So at this point, I would love it if you could participate in a quick interactive poll around this issue of adolescent substance use. So we want to know how many Australian 13 to 14-year-olds you think have had a full serve of alcohol in their lifetime. So to give you a bit of context, these are children who are in about year 8 at high school in Australia. So yeah, we're just interested to see what you think that the level of drinking is among that age group.
Okay, Louise, so lots of people are submitting their responses. I'll just give a little bit more time so that everyone has a chance to respond.
Sounds great. Yes, thank you.
Okay, so I think that's pretty much everyone now. So just closing the poll, and in terms of the response, so interestingly, 43% of people said 1 in 3, and the second top response was 31% of people said 1 in 4, and then 20% said 2 in 4.
Great. Well, thank you everyone for participating in that poll. Just get the screen back up. So actually, it's really interesting that, so the correct answer is actually 1 in 4. So that, as Lexine said, well, that was the second top answer, I believe. So exactly, well done. Yeah. Yeah. So well done. A lot of you did, sort of know the correct amount. But actually, yeah, with the top response being 1 in 3, while most of you thought that that many teenagers had had a full serve of alcohol in their life, the reality is it is a little bit less than that who have had a full drink. So only about a quarter have had a full serve of alcohol in their lifetime. So that is a bit of good news. The other good news with regards to adolescent drug and alcohol use in Australia is that fewer teenagers are drinking alcohol and using illicit drugs than in previous decades. So we know that the proportion of teenagers aged 12 to 17 years old who are abstaining from drinking has actually increased from about 56% in 2007 to about 72-73% in 2013. And these statistics and a lot of the other statistics I'm going to be talking about today from the most recent version of the National Drug Strategy Household Survey that's available. So as you might remember, this, 72% of 12 to 17-year-olds who are not drinking alcohol is in comparison to about 80% of all Australians who have drunk alcohol in the last 12 months. So that's really, something that's a bit quite promising. We also find that younger people are also delaying starting drinking. So we found that in 1998, the average age at which people had their first drink of alcohol was about 14 years old. And this has increased in 2013 to be more like 15, 16 years of age. We also find that the use of illicit drugs among teenagers in Australia has decreased over time. So you can see in this this graph here that there's sort of a general downward trajectory, with about 18% of teens reporting illicit drug use in the past 12 months in 2013. However, as most of you would be aware, the National Health and Medical Research Council of Australia guidelines recommend that for anyone aged under 18, not drinking is the safest option. They particularly recommend that young people aged under 15 years should not drink at all, as they're at the greatest risk of harm. And they recommend that those aged 15 to 17 years of age, the safest option is to delay drinking as long as possible. Despite this, as I mentioned before, most people do start drinking alcohol during adolescence. So fortunately, among 12 to 15-year-olds, we see that the vast majority of teens have never had a full serve of alcohol. So in this age group, we have about 82% who've said they've never had a full serve of alcohol. However, we also find that about 15% of 12 to 15-year-olds have drunk alcohol in the past 12 months, including about 1% who report drinking on a weekly basis. This increases in 16 to 17-year-olds to about 55% of teens who have drunk in the last 12 months, including about 9% who report drinking on a weekly basis. And as well as a small percentage, it's displaying as 0 there, but it's actually not quite 0, it's about 0.1%, who report drinking on a daily basis. And while that's great that that number is so low, it's still really worrying that there are any kids out there drinking on a daily basis. So it's great when we look at levels of risky drinking among Australian teens that most teenagers who drink alcohol do so at low risk levels. So in this case, we're defining low risk as less than an average of 2 standard drinks per day. However, there is a small proportion, about 3% of 12 to 17-year-olds, who are drinking at high risk levels, so more than 2 standard drinks per day. Worryingly, even at these really early ages, drinking is associated with alcohol-related incidences. So we find that among those who report drinking in the last 12 months, about 16% of 12 to 15-year-olds and 26% of 16 to 17-year-olds report being the victim of an alcohol-related incident in the last 12 months. So, while with regards to illicit drug use among Australian teenagers, while it's reduced over recent decades, really any level of illicit drug use is worrying, especially among teenagers. And additionally, research has shown us that illicit drug use is much more common among males than among females. So in this graph on the screen there, males are represented by the red bar. As in the Australian general population, the most common illicit drug used by teenagers in Australia is cannabis, with about 18% reporting that they've ever used cannabis, so used it at least once in their lifetime. About 14–15% have used cannabis in the last 12 months. About 7% have used in the last month. We have almost 5% who have reported that they have used cannabis in the last week. And in 2013, the average age that people said that they first used cannabis was 16.7 years of age. So drug and alcohol misuse is associated with a range of negative consequences among both adults and teenagers. But early substance use, so use in adolescence, has also been found to be associated with increased risk for short and long-term alcohol-related harms, increased risk of the development of substance use disorders, as well as the development of co-occurring mental health problems such as anxiety and depression, also associated with increased risk of physical harms, such as road traffic incidents and other accidental injuries, as well as cognitive impairments. Drug and alcohol use during adolescence may also adversely affect the really important social transitions that occur during adolescence and young adulthood, and that are essential for a young person's later life trajectories. So things like academic achievement, entering the workplace, and establishing relationships. In addition, we also know that really substantial changes occur in the adolescent brain, including some great cognitive and emotional development. And epidemiological research has shown that drug and alcohol use may adversely affect this brain development that occurs during adolescence. And if you'd like to know a little bit more about how drug and alcohol use affects the maturing adolescent brain, Dr. Louise Newton gave a really wonderful webinar as a part of this Positive Choices webinar series, I think earlier this year, that you can go, and I've just included the direct link to the webinar there, which you'll also be able to see in the handouts, or you can just go to the Positive Choices website and look for the webinar series. So bringing that all together, I think it's really clear that focusing on the prevention of adolescent drug and alcohol use is absolutely critical. But then the next question is, of course, how do we do this? And to start to answer this question, I'll hand over to Dana, who's going to present the second part of this webinar.
Beautiful. Thank you, Louise. So obviously the focus of today's webinar is the role that parents can play in the prevention of adolescent substance use. And parents are really important. They play a pivotal role in their child's alcohol and drug use. And research has identified specific parenting factors, practices or factors that have been shown to influence adolescent substance use in both directions. Today we're going to mainly look at the prevention of alcohol use, but there is a really big overlap in the parenting practices associated with alcohol and other substance use. So one parenting factor is actually just parents' attitudes towards alcohol. Researchers found that having more favorable attitudes towards alcohol is related to earlier first use of alcohol in teens and higher alcohol use and harms in adolescents down the track. So to make this a bit more concrete for everyone, a favorable attitude might be something as simple as believing that alcohol is just a good way to relax or escape from everyday troubles. We also know that what, how much, when, and where parents drink also has a major influence on adolescents drinking in the future. So for example, if you're modeling risky drinking, your teenagers are much more likely to be drinking at risky levels. Another parenting practice is also supplying alcohol to teens. So from systematic reviews and meta-analyses, we know that parental provision of alcohol is associated with earlier alcohol initiation and higher levels of alcohol use in the future. It's therefore worrying that 34.4% of recent teenage drinkers were actually given their first drink of alcohol by their parents. You may have noticed that all the factors mentioned so far have been risk factors or parenting practices that can increase substance use. But research has also identified protective factors that can reduce risks. So, for example, we know that just having really clear rules about alcohol is associated with a delay in the onset of drinking. Likewise, being aware of your child's activities, their friends, and their whereabouts can help delay drinking and later alcohol misuse. So can also having a strong relationship with your teen, being involved in their life, and just showing support. And you'll also notice that all of these factors we've spoke about, even the risk factors, are all things that parents have a great deal of control over and that they can change. And this makes them also great targets for parenting programs and interventions. So one parenting program is the Preventing Heavy Alcohol Use in Adolescents, or the PASS program, which has been developed by our collaborators in the Netherlands. So the PASS program targets clear rules against alcohol use in the parents of 13-year-olds. Now this program is face-to-face and it's delivered in parent year group meetings at the start of the year, like in a Year 7 meeting. And it's got 3 components. So first, parents receive a brief presentation on teen alcohol use and harms, as well as the importance of setting strict rules. Parents are then asked to form smaller groups and they reach a consensus on a shared set of rules about alcohol use for their children. So it might be rules as simple as we won't provide alcohol to our teens during the school year, or something like if there's a party, they'll agree to contact each other about how it's being organised. So parents also receive an information leaflet with a summary of the presentation and a report of the outcome of the meeting. So everyone walks away with this shared set of rules to enforce across the year. And this intervention has really impressive outcomes. When it's combined with a student intervention, researchers found a delay in the onset of drinking and a reduction in heavy drinking 3 years after the intervention was delivered. So that's like all the way into Year 10. But this finding that parenting interventions must be combined with student interventions to be effective is in line with several other findings that multi-target interventions perform better than single-target interventions. So for example, if they had have just targeted parents. It's also in line with the findings of a systematic review published this year by our team showing that several combined student-parent interventions are really effective in preventing substance use. However, this review found a major barrier to intervention success was actually parents themselves. So studies reported it was difficult to recruit parents into trials and to engage them into interventions. Overall, parental uptake is low as 6% in one study. And common barriers are really understandable, things like lack of time, cost, difficulty finding transport and childcare to cover the time of the intervention. So this paper suggested that programs that integrate the parent component into existing meetings at school, or if they have an online delivery, have the potential to reduce barriers to uptake among parents. And despite the obvious advantages to online delivery in reducing these barriers to engagement, only 2 student intervention components and no parent components were delivered online. So we wanted to fill this gap and to develop an online combined student-parent program. And this will be the first combined program in Australia and the first combined program internationally that adopts an online delivery method. So the student component from this program will consist of the developed and the effective Climate Schools program, which you may have heard of. So these are universal substance use and related harms prevention programs delivered online across the years in high school. So for our intervention, students will receive the alcohol module and the alcohol and cannabis module in Years 8 and Years 9. So the Climate Schools lessons feature an online cartoon drama, which students click through in each lesson. And the story follows a group of teenagers, and these are about the students' age, and it kind of covers their interactions with drugs and alcohol and what they learn along the way. So in this scene, just as an example, Claire and Michael are hanging out with some of their friends. You can see that Michael is off with some of the older kids drinking, and he wants Claire to hop in the car with him and go for a drive. But you can see that Claire obviously doesn't want to because the driver is drunk. And you can see from this last slide here that Claire is learning about statistics of alcohol-related fatalities from her friends. And this is just a small example, but it shows the ways that students are learning material and statistics without having to hear it from a teacher or from another adult. And there's a strong evidence base to the Climate Schools program. So there's been 6 randomised controlled trials conducted across Australia in 157 schools and over 14,000 students, and 17 papers reporting their effectiveness. So to give an example of some of the findings, here's the findings from the alcohol and cannabis module. And so these lessons were found to increase alcohol and cannabis knowledge, decrease the frequency of cannabis use, decrease alcohol consumption and binge drinking, and also reduce truancy. I find that really cool. So with the student component covered, we moved on to developing the parent component. And to inform development, we conducted a scoping survey to get the feedback from Australian parents of high school students. So with ethics, we recruited online, mainly via Facebook, and we surveyed parents on their use of technology, their preferences regarding a parenting program to prevent substance use, and also their attitudes towards a range of substance use rules that they might set. And in the end, we had 242 Australian parents of high school students complete the survey. Interestingly, this sample was overwhelmingly female. We actually had more people speaking a language other than English and more Aboriginal or Torres Strait Islander individuals complete the survey than we did have males. But there was a nice spread of what year the parents' children were in, and I've also included the employment status of the parents there, so most were in some kind of employment. So just to sum up the results, we concluded that there was indeed a need for a parent program. Only 19% of parents were confident that they could stop their children from becoming drunk. As we suspected, parents wanted to access this program online. So 71% wanted to access it via an app, email, or school website. We found it interesting that parents really care about the credibility of these programs. So 98% said it was very or extremely important that the information was evidence-based, and 90% said they wanted the institution making the program to be reputable. Parents were interested in the proposed features, so we suggested to them a number of features like webinars and emails and things like this, and parents were generally interested in all the features. But we found that parents wanted the program to be self-paced and easy to use and really brief. So most of the parents wanted to spend under 10 minutes per week on the program. So with parents' feedback from this scoping survey and the research we discussed earlier, we have begun developing the parenting component of our intervention, and we've called this Climate Schools Plus. So the parent component will primarily target rule setting, like the PASS intervention developed by our Netherlands collaborators. But we'll also address several of the other modifiable parenting factors we spoke about earlier. So the program will have 3 parts. First, parents will attend an interactive webinar to target rule settings. So parents of a particular year group at one school will all log on at the same time and watch a brief presentation on adolescent alcohol use and harms and the importance of setting strict rules. And then, like in the PASS intervention, parents will be able to rank rules via the online system, and that parents of that year group will walk away with a set of rules for the whole year to enforce. Next, parents will have access to 6 brief, engaging online modules, and these modules will address the modifiable factors we spoke about at the start. I'll give a bit more information on them next. And finally, parents will also be emailed weekly summaries of what students are learning in the student lessons. So just some more info on what's going to be in the modules. I've presented here a really brief description of each of the modules and which parenting factors it targets. So I'll just talk briefly to Module 2 and 3. So you can see that Module 2 is going to target attitudes, rules, discipline and monitoring. So it aims to educate parents on the role that they play in preventing alcohol use and harms, and to encourage less permissive attitudes and encourage stricter alcohol-specific rule setting. We'll also cover the role of parental monitoring. So that's knowing where your teen is and who they're with and what they're doing and things like that. And this module will also look at why teens use alcohol, and it will also link to the set of rules that parents agree to in the webinar. Another example from Module 3. This one aims to educate parents about the role of supplying alcohol to teens based on their current evidence, and it'll give tips around supplying and not supplying to teenagers. It'll also address the importance of parental monitoring, so like parents' own alcohol use, and it will include a link to the audit, which is a brief screening tool for alcohol use disorders. So parents that wish to can go and assess their own alcohol use, and it will give a brief intervention based on the scores. And here are the 3 other modules I won't talk through. So where are we up to and where to next? So the program development is nearing completion, and you can see here on your screen some of the drafts of the content that will go into the website and the modules. Soon we'll be ready to actually test the parenting component. So first we'll be seeking feedback from parents on how user-friendly the intervention is and how useful the content is. Then we'll be pilot testing the program in parents of one year group at a particular school. And finally, once we take all the feedback from parents into account, we'll be conducting a randomized control trial to assess the effectiveness of the program in reducing alcohol and cannabis-related harms in early 2018. So if you're interested in testing out the program, or if you'd like more information, please do send me an email. And in the meantime, Positive Choices is a great place to check out if you would like more parenting resources. And if you would like to read a bit more, here are the key papers that we covered today. And thank you so much for listening.
Okay, fantastic. Thank you so much, Dana and Louise. That was really great. And we've already, I can tell that the audience were very interested as well in the topic, because we've already got some questions coming through for you. So that's fantastic. So Wonderful. If anyone else in the audience has questions, please feel free to send those through to us now, and we'll aim to answer them. So first of all, thank you. That was so fantastic. And I guess I was just wondering, it's great that the parenting program is coming, and I'm sure everyone's very excited to see it coming. And just in the meantime, would you suggest, are there a few key things that parents can do, right now when they go home today, to help prevent teenage substance use? What would you recommend to them?
Sure. Well, first of all, thank you so much for everyone listening and sending in those questions. So to answer that question, so as Dana mentioned, there are a few key things that parents can do that research has shown are associated with preventing adolescent alcohol use. So the first thing that the research sort of suggests that parents can do is simply to and this is regarding alcohol specifically, is to not supply alcohol to their teens. So research has found that parental supply of alcohol is actually the top parenting risk factor for adolescent alcohol use, whereby adolescents whose parents supply alcohol or allow them to drink at home are actually more likely to start drinking or have alcohol-related problems earlier, drink more frequently at higher quantities, and have more alcohol-related problems later in life. There's also good evidence that being more aware of your adolescents' activities, whereabouts, and friends can help protect them from alcohol misuse and alcohol-related harms. And similarly, research suggests that it's important not only that parents model responsible drinking behaviours themselves, so drinking in responsible ways, but also aren't communicating favourable attitudes regarding alcohol use to their kids. And Dana gave a few examples of what some of those favourable attitudes might be. Additionally, having a good parent-child relationship, being involved as much as possible in your child's life, and enforcing clear rules against underage alcohol use have been shown to be protective factors for adolescent alcohol use. And I'm aware that, implementing some of those strategies might be easier sort of said than done, but those are sort of some of the things that at least the research says parents, can do now to try and help prevent adolescent alcohol and substance use.
Fantastic. And just on that rule setting that you mentioned, how important do you think it is that parents are all on the same page? I noticed you were talking a bit about consensus in some of the interventions. How important is it that other parents are on the same page as well?
Yeah, so one of the things that sort of comes up that parents mention as being difficult, and actually was mentioned a few times in the scoping survey that we conducted, was that it is really difficult sometimes to enforce rules when you're unaware or not sure if other parents are doing the same thing. So, the idea that, Johnny comes home and says, oh, but, Sally's parents allow her to do this, and it can make it really difficult. And that's sort of one of the core aspects of the PAS program that was developed in the Netherlands, this idea that it makes it so much easier for parents to enforce these rules and confidently enforce these rules if there is a consensus between the parents of friends, or in this case the parents of a year group. And that's why we've adopted that sort of setting or that strategy for the parent intervention as well. So I think it can be quite important in terms of giving parents the confidence to enforce those strict rules that we know can help prevent adolescent substance use.
Yeah, okay, fantastic. And so you've talked a lot about that scoping survey, and so I guess the way I understand it is that that parents have been involved in the development of this resource, really, in their giving their feedback, giving their input, saying what's important to them. Is that right?
Yes,
absolutely.
Certainly.
Okay, fantastic. And so a question about that's come through is about, was the participation in that survey restricted to Australian parents, or did you have other people outside Australia?
No, that was just Australian parents.
Okay, so you were really trying to get information and context that would be relevant to the Australian setting.
Yeah, absolutely, especially because we are drawing from a program that was developed in the Netherlands. We want to make sure that the way that we adapt that is really relevant to Australian parents.
Okay, excellent. And then we've got some really interesting questions coming through. So another question was, when you're developing the module, so you talked about parents kind of lack of time, or that was a potential barrier. And so the question was, what is the duration of the intervention, and are you tackling that issue of parents' lack of time through the development of the intervention as well?
Yeah, we definitely are. So the way that the intervention works is that initially parents are invited to attend that webinar and at a particular time, and that's going to be sort of a 15 to 20 minute kind of presentation. So again, trying to just keep everything really brief based on that feedback that parents, a lack of time can be a real barrier. Additionally, one of the advantages we think to taking this program online is with the PAS program, where they had to attend a sort of a face-to-face meeting at a school, so that just occurs at one particular time, and that might not be convenient for all parents. While the webinar will first take place at a particular time, and we're hoping that most parents will attend at that time, it'll also be available for parents to watch it, at any time afterwards for a period of 2 weeks. So we're hoping that makes it a little bit easier for parents who might not be able to attend at that particular time. And additionally, when we've been developing each of the modules, there's 6 modules, and we've made sure that parents are able to fully explore each of them sort of within that 10-minute scope that came out as sort of that cutoff that most parents sort of said that they would be able to dedicate to this sort of program during a week. And In addition, then parents are emailed the summaries of the lessons that their kids are doing, and that just goes to their email. So again, you know, that's something they can quickly go through at a time and place that suits them. So yeah, we've really tried as much as we can to keep that lack of time in mind and try and make the program as flexible as possible as well.
Okay, and I guess sort of related to that, the parents that you had involved in that development survey were primarily female. So do you think that that's something about the way that you recruited, and you know, what's the implications, I guess, of that for you?
Yes, it was a huge gender split, like 96% female. And we did actually try really hard to recruit more males. So when we got the first wave of data through, it was only like 1% males. So we tried really hard, and we changed the ad up so we were specifically asking for fathers. And even after running that ad, we got it up to what it was, which was around 4% males. And we're not sure why the participation of males was actually so low. And when we do move on to beta testing, we will be like really deliberately seeking the feedback from dads in like more deliberate ways. But just from talking to parents and teachers and other resources, we get the impression that the gender split in our scoping survey might just be reflective of the sample that will actually be doing the intervention. So while we'll invite all parents and caregivers to engage in the program, it might be the mums that actually take up the program. So it might just be like a reflective sample. But we are going to take this into account into development, definitely. So we're including, for example, content really stressing the importance of sharing this information with your co-parent and like maintaining a united front and making sure everyone's on the same page. And also including things in the development like easy share features, so you could email or message particular content over to your co-parent. Yes, I hope that answers the question.
Yeah, absolutely. And we've had a question through about young people in rural areas. So you mentioned the statistics on drug and alcohol use, but are the differences in terms of city and rural areas for those stats?
Yeah, sure. So drawing on the same, the study, so the National Drug Survey, Household Survey, we have found that people living in, and this is just, Australians in general, so I don't have the statistics for adolescents specifically, but we know that people living in remote and very remote areas were actually twice as likely as people living in major cities to both smoke daily, drink alcohol in risky quantities, as well as use methamphetamines in the previous 12 months. And, we know that, so it's clear that it's really important to support people in rural and remote communities, especially as, often services are even more lacking in these areas. So we think that that's one of the advantages that we've taken this online approach, so that this program will be available to everyone, including those who are geographically isolated. And there's also some differences across states as well. So, for example, people in the Northern Territory and Western Australia were found to be more likely to consume alcohol in quantities that place them at risk for an alcohol-related disease or illness or injury. But then in terms of illicit drug use, that study found that there weren't any differences across the states in terms of illicit drug use.
Okay, so that sort of links us to another question that's come through about whether, in terms of the schools or the parents that you'll be getting to participate in the program, have you any ideas about the split in terms of city, rural, in terms of who you're recruiting for that testing of the program?
So we're still actually in the stages of designing that implementation study that Dana mentioned, that we will be testing it, but certainly we've mentioned this idea that ideally we'll have a really nice split across rural and remote and urban settings, socioeconomic status and things like that, because we do if we can, we want to try and get an idea as much of how feasible and effective this program is going to be in a wide range of schools and demographics.
Yeah, excellent. Well, so that links nicely to another question, and that's come through about how the module is going to be promoted to parents. So I guess that's a big step. Next is to make sure that parents around the country know that it's available, and particularly, as you said, in a range of different settings.
Yeah. So first of all, it is early days. So first of all, as Dana mentioned, we're doing some beta testing and pilot testing, and then there'll be this implementation trial. So the program will only be available to those parents at schools who are participating in the trial itself. But then if, it's shown to be an effective program, certainly the goal will be to roll it out much wider, promote hopefully via, portals such as Positive Choices, and get it out there and make it as widely available as possible. But of course, first of all, we want to make sure that we are really certain that this program is going to make the difference that we think it's going to.
Excellent. So for the time being, though, people out there can get involved in terms of talking to their school about potentially being part of the trial of the program.
Yes, definitely. So you'll see in the little evaluation survey at the end of this webinar, we've asked for those people, who are affiliated in some way with any secondary schools, and who might be interested in hearing a bit more about the testing that they were doing and potentially getting involved. We'd love to, hear from them, because, we will be looking for schools a little bit later on to start trialling and helping us to test this program out. So, we'd definitely love to hear from everyone.
Yes, and we've got a comment just coming in, someone who said, thanks for the webinar, and I'll pass it around to my network. So I guess that's one of the that's one of the ways that we will be sharing the news about this program. So if everyone that's hearing about it today and that's interested and that thinks it's a great idea can let other people that know that it's coming and know that there's an opportunity to get involved, I guess that'd be really fantastic.
Yeah, that really would be.
Cool. Okay. Well, look, we've grilled you with questions for a good long while now. So thank you everyone for sending in such interesting and thought-provoking questions, so that we could have this useful discussion today. And thank you very much, Louise and Dana, for taking all the questions and also for your presentation itself. And so now, just to let you know, that we will be sending out a link next, which will have a link to access the video recording and also the handout from today's session, so that you can pass it on to others. And in addition, just to remind you that we do have a whole collection of videos and webinars available as part of the webinar series. So there are several topics, including these ones that you have on the screen now, which are available to watch on demand that have been in the past. But in addition, we're always trying to find out what topics people want to know more about and develop webinars in response to those and in response to new things that are going on. So we will have additional webinars coming up over the year, and you can suggest topics you'd like to see for those webinars. And the best way to stay informed is to register at the Positive Choices site. So that will mean that you'll be on our mailing list, which many of you probably already are. But if you're not, get on that mailing list, and then you'll be informed about everything that's coming up. So thank you very much to everyone for being part of this afternoon, and we really look forward to seeing you at one of the next webinars. So thank you again, Dana and Louise.
Thank you.